From rosemary oil to pumpkin seed extract, the internet is full of so-called natural cures for hair loss. Patients often ask me, "Doctor, do these remedies really work? Or are they just old wives' tales?" As a hair transplant surgeon, I've seen both sides. People who swear by natural oils and people who only trust prescription pills. Today, let's compare natural treatments with conventional medical therapies side by side and find out what's truly effective. First, let's talk about the appeal of natural remedies. Many people feel more comfortable using something from nature rather than a prescription drug. It feels safe, affordable, and free of chemicals. Honestly, the idea of rubbing rosemary oil on your scalp sounds much less intimidating than taking a pill every day. Cultural traditions also play a role. In some countries, herbal medicine is a normal part of healthcare. And of course, who hasn't had a grandmother recommend onion juice, garlic rubs, or scalp massages for hair growth? But popularity doesn't always equal effectiveness. That's where we need to look at the science. Let's start with some of the most talked about natural options. Rosemary oil. One small study actually compared rosemary oil to 2% minoxidil. After 6 months, both groups improved, suggesting rosemary may have some effect. But remember, that's 2% minoxidil, not the stronger 5% most men use. So results were modest. Pumpkin seed oil. A Korean study showed men taking pumpkin seed oil capsules had more hair growth than placebo. But again, the effect size was small, and we don't have large-scale replication studies yet. Saw palmetto. This is often marketed as a natural finasteride. It does seem to weakly block DHT, the hormone that drives male pattern hair loss. But it's far weaker than prescription finasteride, so results are inconsistent. Onion juice, acupuncture, scalp massage. There are anecdotal reports and maybe some small benefits for circulation or scalp health, but nothing close to the level of evidence we demand in medical science. Overall, natural remedies may help a little, but results are usually mild, slow, and unpredictable. Now, let's compare with the heavy hitters, finasteride and dutasteride. These block the enzyme that turns testosterone into DHT. By reducing DHT, we can slow or stop further hair loss in most men, and even regrow hair in some. These medications have decades of clinical trial data and real-world use. Minoxidil. Originally a blood pressure drug, minoxidil stimulates follicles directly. It's not about hormones, it's about kickstarting growth. Used consistently, it's effective for both men and women. PRP and low-level laser therapy. These are supportive treatments. PRP injects your own growth factors into the scalp, while laser caps may improve follicle activity. Results vary, but evidence is growing. Think of it this way. If hair loss were a sports team, finasteride is the captain, minoxidil is the star striker, and PRP is a supportive midfielder. Rosemary oil may be the enthusiastic mascot. Let's put them head to head. Effectiveness. Conventional treatments win. Far stronger and more predictable results. And safety. Both are safe when used properly. But natural doesn't mean risk-free. For example, saw palmetto can cause stomach upset, and essential oils can trigger allergies. Evidence. Dozens of clinical trials for finasteride and minoxidil versus a handful of small studies for natural remedies. Cost and accessibility. Natural remedies are usually cheaper and easy to find, but require long-term, consistent use for any visible effect. My take as a surgeon is this. Natural remedies can play a supportive role, but they should never replace proven therapies if you're serious about stopping hair loss. Sometimes I even encourage patients to combine approaches. Use finasteride or minoxidil as your foundation, and if you enjoy rosemary oil or pumpkin seed supplements, add them. Just don't expect miracles from the natural side alone. The real danger is waiting too long with only natural remedies while your hair continues to thin. By the time you realize it's not enough, you may have lost valuable donor hair for transplant. So, the smart move is early diagnosis, medical therapy, and then natural add-on if you like. Hair loss is complicated and there's no one-size-fits-all solution. But one thing is clear, natural remedies can't yet match the effectiveness of medical treatments. If you found this breakdown helpful, subscribe for more medically accurate guidance. And if you're considering a hair transplant here in Korea, I share videos every week to help you make the best decision for your hair.